We're going to talk about equine dentistry. Hi, I'm Sean Strain if you don't know me. We're going to try to make this as quick and down and dirty as possible, and there'll be a lot of other things that we're going to do with equine dentistry over the next year to two, okay, with the practice and everything like that. One thing that people are asking me, well, Dr. Strain, you're our leg guy. You do this, you do that, you do our full care. Does this mean you're just going to be an equine dentist? No, I'm going to also do everything else. So this is just another modality for the Kansas City area, among a couple other things that we're going to be exploring over the next little while. So we're going to move on. Let me just make sure. No, that's not going to work. Okay, so most of us think of equine dentistry as, or you're just going to go have a horse floated. But the act of floating is going in, taking up the high points, and closing the mouth up, and moving on, paying your money, walking out the door. A lot of the words are changing nowadays. There is floating. There's what we're calling equilibration and balancing. It's not only just veterinarians, guys. This is lay dentists. We're talking the grand picture here. We're talking people that are actually spending money to go and get properly educated by people who have been doing it for 10, 20, 30 years. So we're learning from these guys. People from Europe, people from Canada, people from all over the world are actually coming together, forming an association called the International Association of Equine Dentistry, which is veterinarians and lay dentists that are really making a huge difference in this industry. They're developing new techniques for extractions. Mainly, one of the things about extractions, which is one of the reasons I got into this, was that almost 99% of the time now we do not have to knock horses down. There are ways that we can do this standing, and ways that we block these horses that we haven't been able to do. We haven't really put a lot of knowledge to it, and over the last quite a few years, we've actually learned some things. So not only are these guys that are doing this, they're working on different techniques and different ways to make these horses comfortable, different ways to diagnose these things. Performance and function is obviously the main goal. Happy, healthy, longer horses, making them better eaters, which actually in turn, you make them better eaters, it means you're spending less. So you don't have your plumber do your electrical, you don't have your lawn guy shoe your horse. There's some husbands that actually shoe horses, so we'll leave it at that. Just like in human veterinary medicine, it's becoming more and more specialized. You look at East Coast, West Coast, you look at Europe, there's people out there that are only doing equine dentistry, that are specifically specialized to do this. And it's on top of the education part, but these horses you don't have to be an Olympic horse to have just an equine dentist work on your horse. All right, and these are horses that are everything from trail riders to extreme showing horses. Where have I been the past year? Okay, well, for the last 2 months, or not last 2 months, I've taken almost 2 months away from our practice this year to go and learn with these guys. This is a small town in the middle of Idaho. There's over 50 students there. Over 50% of the students are actually from over the pond. We've got veterinarians, we've got lay dentists from Germany, from South Africa, from Poland, from Holland, you name it. They're all over the place. So this is just a little bit. I actually took this from the Academy of Equine Dentistry. It's run by a gentleman by the name of John Fortcamp and a veterinarian who is out of Nebraska named Dr. Bernie Fletcher, but it is taught by our peers. It's taught by people that know a lot more about teeth than I do. February, 2 weeks, I was in Glens Ferry, Idaho for the 100 level, 200 level. November was the 300 level. It's also advanced lab. Passed the AD. December, I was in Nashville for the annual AEP convention, learning something other than teeth. So I just got back from a 20-year certified equine dentist down in Houston, which was a very big eye-opening experience for me. February, hopefully, we'll see how this goes. This is where I take the final practical tests, and also graduation. So took 2 months away. Couldn't have done it without great support staff. Couldn't have done it without my associate. takes more time. You know, this is more than just a 20-minute ordeal anymore. You know, this is one thing I always tell people. I said, think of it, if you go to the dentist, some of us have cavities, some of us had our teeth filled. They sit you up, they go, okay, you know, you're done. But doc, I'm hanging up on one tooth. That's fine, you're done, go home. Not only are your teeth going to hurt, your TMJ is going to hurt, you're going to be an uncomfortable person. And this is one thing that we're looking at, and you'll kind of see as life goes on. I'm doing a lot of teaching, I'm doing a lot of talking, a lot more than I normally do, because I talk a lot. One of the big things that we're teaching, that I've learned over the past of this last year, is positioning. Getting the incisors in. You know, when you've got a horse that's got a wedge mouth, when you've got a horse that's like this, well, I don't have a speculum that goes like this. I got a speculum that does this. So when I stick a speculum in a horse's mouth, that's the thing that opens the horse's mouth, and it's a wedge like this, it has nowhere to go but here. So where does that translate to? To our TMJs. What usually happens? 10 to 12, 15 minutes after I sedate them, guess what? I'm grabbing drugs. I'm grabbing drugs because your horse is coming awake. Why? Because the horse is painful. So we pay very close attention to teeth. We pay very close attention to movement of the actual tooth. We look at pulp depth. We look at a lot of different things. Horse owners are noticing a huge difference, and this is one of the things. You know, I do a lot of leg work. This is the fifth leg. This is that extra 10, 15, 20% that we are missing in these animals. One thing I did do, they said just to call it 8 feet. It was actually 7 foot, 11 and a half inches. Took me an hour and a half to bring in. This was last February. So, who's comfortable here? I'm comfortable. The horse is not. You can see here, the horse is hyperextending at the pole. He's not comfortable. This is a big problem. You know, this requires more sedation. I'm comfortable. My wife is really comfortable. Flies are not. This is comfortable. This is comfortable for the horse. It's comfortable for me. You got decent posture. Everything works really well here. Majority of horses that I'm working on now, by the time I'm done, most of them are awake. Whereas before, they're pretty drunk still. Okay, so a lot of these guys, you get these guys comfortable. You guys get, you balance out these mouths so that their teeth are focusing on the level part of the speculum. They do a tremendous amount of, tremendously better. Natural head position, less sedation, happy horses. This is a better idea though. Horses have potentially 44 teeth in their head. Okay, we always think that wolf teeth, they only have 2. No, they have 4. I took 4 out the other day. Canines, you got 6. There are 3 incisors on either side. We split. Everything gets split in 4s here. Okay, we fill out forms now after dentals. We've been doing it for about the past year. If any of you have had it done, we're just doing things a lot differently. Biomechanics. Bio equals life. Mechanics, you guys know how that works. It's laws of levers and pulleys. In this case, we're looking at how dentistry applies to that. What moves it's not the head that moves, it's the jaw that moves. It's the mandible that moves. Axial flow. Axial flow is the movement of food from the time it comes off the ground to the time it gets to the back of the throat. There's a lot of things that prevent axial flow. And we're touching on bait. We're mainly getting on the top of this and just briefly going over, because really 2 months of lectures that I sat through, you can't do it in 20 minutes. So what prevents axial flow? Anything that prevents food from going to the esophagus. As you can see here, does this prevent axial flow? That is a stick shoved between, this horse was having difficulty eating for 3 days. You would think that this horse would not eat at all. Horses are compelled to eat unless they're colicking or dead. There's really no other way to look at it. Colic or death, they stop eating. This prevents axial flow. In this picture, you've got a large hook. Do we still have that pointer? Where does that go? We've got a hook. We've got a wave. We've got 2 hooks. This does not go well. Use my mouse with the arrow. If I can find my mouse. Right there, hook. Transverse ridging, okay? This is called washboards. Okay, this here is a wave. The bottom tooth has a large hump to it. Majority of your guys' horses, we get into older horses here. This is what happens when horses' teeth don't get done when they're younger. You end up with stuff like this. One of the things, well, let's hold on a sec. How many people think, we'll just do a little poll here. How many people think horses chew up and down, primarily to eat hay? How many people think they chew side to side only? Only. Okay, Mason, can you grab the skull for me? Horses chew in a motion that, unlike us, unlike dogs, you know, we crush our food. These guys, they roll it and crush and roll. The way horses move here, we bring it over here. Come on, good man. There you go. Turn around, turn around. Smile pretty, Vanna. All right, so one thing that horses do here, and I'm going to actually move the maxilla. Horses drop their jaw, move it to this way, right there. They move it to the side. Pick it up, Mason. Pick it up, pick it up, pick it up, pick it up. Real high, go higher. You can do it. We move, the jaw drops down, it moves over, it comes back up, and it crushes on, so if the jaw is moving to the left, you see how that works? Drops down, moves over, comes up, and across. So it's actually a movement down, out, up, and in. The food bolus actually moves in the opposite direction. Okay, so it's where when you start having feed issues in some of these older horses, they will actually start to ball, you know, they can actually start forming cigars. One thing that we don't think of, okay, so after going over that, thank you, Mason, you may sit down. One thing that we don't know about, and this comes down to a performance aspect as well. Horses, like Dr. Brooks said, like Dr. Emily said, like Rhonda said, like Dr. Val said, is we are our worst enemies when it comes to our horses. How do we usually feed our horses? We feed our horses in a grain bin up here. Some of us feed in a hay rack. Some of us feed in a hay bag. Some of us feed on the ground. Naturally, horses want to feed on the ground. Out in the wild, they chew down below all the time, which is where you get rid of these ridges that they form. All right, these transverse ridges, because as they're moving, that lower jaw actually has a natural ability to shift. Some horses will move 1/4 of an inch. Some of them have moved almost 3/4 of an inch forward. Okay, and this is where, you know, we'll get into this. This becomes a riding issue as well. So what a lot of horses do around where we are, they may go down, pick up their hay. Where do they go? Up here. And they want to look around, they want to chew, they go down, pick it up, come down. If you look at horses that are turned out all the time, what are they doing? They got their head down the entire time, and they're chewing, and they're doing their thing. Every once in a while, you got a sentinel horse that's looking for the lion. They can't find it, all right, go back and down and eat. Horses are grazers, that's what they're meant to do. It's, you know, we are, like I said, we're our worst enemy. We're not choosing our breeding protocols because of our teeth. We're choosing them because they jump well, they show well, they move well. You know, this is where teeth become a really big issue. We're not dealing with Mustangs that, you know, it's survival of the fittest. So we're talking about rostrocaudal movement, and this is going to be a good portion of what we're talking, you know, of my lecture today. And this is one of the things on my second day in February. I've been doing teeth 11 years. And I was the oldest person, well, I'm not the oldest person there. I'm the oldest person there taking their course. Majority of people there are young people, veterinarians that are fresh out of vet school. So I was either going to be their worst student or one of their best students. I didn't do so bad. But long story short is I went in with an open mind. I went in not as an alpha person. I sat down and shut up. Probably some stuff I should do here, you know, in real life. But, you know, ultimately the second day in there, they were talking about incisor angles. Incisor angles make or break you. The TMJ joint, the TMJ, which is also our temporomandibular joint. If anybody here has TMJ, I'm sorry, you know what it feels like. It's debilitating. It hurts. It affects how you eat, sleep, and live. Okay, this is just a little more pictures. We all love pictures. You know, we're also looking here at tongue damage. We're looking here at soft tissue damage. We talk about that down, out, up, and back in. As a whole, that horse has a very large range of motion when it comes to their jaws. And when they have soft tissue damage, you're not going to go down, up. You're not going to have that big oval, if you will. You're going to shorten it, because the more you go out, the more that cheek pushes out. So so what that's doing to these guys is, number one, they're shortening their stride, they're shortening their range of motion, and then they're causing those teeth to actually be a lot more steep. And steep leads to shorter and shorter and shorter. Okay, so at some point you actually start chewing. They start chewing like humans, where it's up and down, or more like humans, I guess you could say. This is an X-ray. This is axial flow. This is where the food starts. It comes down, comes down, comes down, comes down, and then what does it do? It hits the back of this tooth. This is actually a tooth that, when we open this horse's mouth, that's the tooth right there. This tooth was actually loose and had no attachments at all in this horse's head. This horse actually had a broken jaw. And this tooth, the other bottom tooth, had actually impacted down in. You can't really see it. It's actually down in through here. But this affects axial flow. It affects a lot of other things too. Okay, wave mouth with caudal hooks. We got caudal, rostral. Rostral is forward, guys, just in case you didn't know. This will prevent forward and back motion. This will also prevent the horse from chewing side to side. Lateral excursion is what we're talking about, side to side motion. As some of you will find out, when we do our initial exams, we'll look at these guys, we'll push their jaws to one side or the other, and a lot of these horses lock, where you start pushing them over and you go to let the jaw go, and it should just go right back to the way it is. They'll stay there. And it has to do with a lot of the ridging. It has to do with a lot of pathology that these horses are. We deal with weight. We deal with these used to be called wave or wedge mouse. We call them DGL4 because it gives us a DGL4, DGL3. We can go over that more, but ultimately this is the foreside, and it's on an angle. This affects the way they chew. It really affects the way they perform as well. This here is a little dorsal curvature. We can go over a lot of pathology. I can sit here all day, but this horse, or also known as a frown. This horse is actually chewing a little more up and down, and we can go into why, but if you try to slide this horse, this tooth will hit, okay, and prevents this horse from sliding, as well as this tooth is high, this tooth is going to hit that tooth. When this mouth goes this way, this tooth is going to hit this tooth. This is really messed up. These are fun. When I see a case like this is why you go to dental school. It just kind of makes you just a little, it makes you really excited, because these horses will make or break you. You either look like a hero or zero when you're done. Another one, this is an old cribber. This is a really old horse. You got a lot of periodontal disease here. There's some other things going on here. Everybody likes pictures. It can inhibit both. It can inhibit both lateral and rostrocaudal movement. You've got hooks back here. Makes it really hard for that jaw to move backwards and forwards. You've got a wedge, that's going to hurt you as well. This is a fractured tooth. This is a fractured lower 3. It's fractured off at the gum line. We actually took this out. It's actually missing a tooth here, and this tooth here is extremely overgrown. Muscles of mastication. This is really quite interesting. When you look at these guys, 2 of these you cannot see. You cannot see the digastricus, you cannot see the pterygoid, but the masseter is the major cheek muscle that sits right here. We all have it. When you sit there and grind, it's that piece of muscle that really, that you really start, you can obviously see when somebody gets mad. The temporalis muscle on a horse is that one that lays right between their ears. It's that 2 little heart shape that sits there. And just like a guy at the gym or a woman at the gym, if you sit there and do bicep curls, your right side will always be bigger than your left side. And when you look at these horses, some of these horses that are only right-sided, their right side temporalis muscle will be bigger, or their left side will be bigger, depending on what side they are. Horses can be left and right-sided, guys. So we keep that in mind as well. But horses should be able to move equally in both directions. Externally, external exam before we sedate, that's very important. You know, taking a medical history, that's big. Muscles and mastication, we look at those. Head carriage, is the horse coming in with a head tilt? Bone deviation, breaks, abnormalities, we look at those. Age of the horse, how much tooth are we going to be able to safely take if there is pathology? That's important. You take into, horses' teeth are always erupting until a certain point, then the tooth ends. Unlike us, when we're born, when that permanent tooth comes in, what you have is what you got. Horses, when they start out, and I think that skull right there, I think that's a 4-year-old mule. His tooth roots are that big. Okay, when this is a 24-year-old horse, they're going to be that big. Okay, so and they go down from there and they become very, very loose. Tongue size, this is a lot of the other things that, from a person that doesn't ride professionally, that doesn't do a lot of riding, as a veterinarian, you never paid attention to bit size. Why would tongue size. Why would sex make a big deal? Mares have a smaller bar space. They have a thinner bar space than do geldings or stallions, which means bits play a big role. You may not be able to put the same bit in a gelding that you can put in a mare because of the size of the bit. The tongues, you look at a big quarter horse, you look at a big halter horse, they're going to have huge tongues, big, meaty, gorgeous tongues. You look at a saddlebred, just because they're a little finer, they've got thinner tongues. Not to say that saddlebreds have big tongues, little tongues. I'm just saying that, I'm just throwing it out there. Okay, overall physical condition. This here, you can see very clearly on this one. You look at this. This is the right side of the horse. This is the left side of the horse. You can see there's hypertrophy here. Hypertrophy means the muscle is bigger. So this horse is actually chewing more on his left side. Or you could say less on the right side. Physical condition, we talked about this. Okay, if the horses come in and they're too skinny, we're not doing their teeth, guys. That's why they developed Equine Senior. Right? Where are you? You're right there. Bigger muscles, this plays a big role. Where are we going to go? Head carriage, does the horse come in with, chewing like this, or does he, swellings? We may have to take x-rays, which we can do in the field. Do we have enough to make necessary corrections? One thing that we do not want to do, one thing that this whole program teaches, is you pay attention to tooth roots. You pay attention to pulps. You do not want to pulp one of these horses. Because that's an open cavity. That's an open tooth. And if anyone's ever had a cavity before, you know what they feel like. That's exactly how you need to start thinking about these horses. Because if you've got an open pulp cavity, those horses can be just as sensitive in the bridle as they are chewing. And it's something that I would have looked past for the last 11 years. Okay, there's things that I've never paid attention to. Okay, a lot of the bit, from what I understand with bits is, as a veterinarian, we typically don't make recommendations. That's going to be between you and your trainer. If you're having problems and I look at it and I go, hey, what's your bit? How big's your bit? And then we look at it, that might be a problem. There may be something there, but if you ask me what kind of bit to use, I'm going to look at you like a deer in the headlights. Tongue size, big or small, what kind of bit? Why do we do incisors? Incisors are the front of the mouth. Incisors are the first thing that horses are going to chew with. It's the first thing they're going to grab. It increases lateral excursion, which allows them to have more range of motion. It allows them to grind more. It makes them more efficient. We talk about negative pressures. That's a whole different ballgame. Increasing occlusion. Occlusion is where teeth come together. We look for simultaneous occlusion when we're coming together. When you balance a horse's mouth, when that horse chews on that side, you want it to hit on as many good teeth as possible. This is a picture, actually I just took this recently. This is a horse this is actually a picture of the horse's head up and head down. Okay, I just didn't take because it didn't move. This horse is locked. Okay, after doing equilibration, after balancing this horse's mouth, okay, that's how far this came forward. I don't know how many horses that will take from this and we'll take it, and this is the horse's head with his head down, and I don't know how many horses we take, and that jaw, all of a sudden, we've got an underbite on a horse that had an underjet, what we'd call an underjet, whereas we had an overjet before. So it makes a big difference, and you don't think, well, what's a half inch going to do? A lot. We like to look at the TMJ. The TMJ is in the back of the jaw. You know, it's back here. It's right behind the eyeball. That is a very big landmark for how we're supposed to look at these guys. You know, you're not going to get a protractor. We're pretty much just going to, you know, there's some gross ways that we're going to look at this. It's important for everyday eating. It's the fifth leg in performance horses. So what we're showing here, I've X'd where the TMJ is, okay, in this area here. This here is a straight piece of wood. And what we're looking for, this is what I'm talking about angulation here. This is going here. Okay, so why are they important? At rest, the only thing that should be touching on a horse are their incisors. They should not be touching their molars. It's like people grinding their teeth at night. You don't want to do, you know, it puts too much pressure on the back of their mouths. So one thing that you need to think about here, when a horse has a steep incisor angle, when that angle, okay, when that angle is, sorry, here we go here, hold on. When you look at this, and a good portion of horses, a good portion of my horses, and it has nothing to do with what I've done in the past, it's just that we just haven't been paying attention, because 85% of us only do what? Float the back of the horse's mouth, we close it up, get paid, move on. Okay, we're missing the boat here, and this was an eye-opener for me, and this is one thing that's really helped me out, and helped out a lot of my performance horses. When you have an angle, a steep incisor angle that moves in through here, okay, what these horses have to do, if you've got a cavesson on your horse, you've got a noseband on your horse, what these horses have to do when they have a steep angle, what ends up happening is that this jaw has to shift forward. Well, what it does is, because it's got to get past the hook that's in the back, it's got to get past the front of the mouth. What they end up doing is, some of them will actually open their mouth. Some of them, you know, it actually will increase the space that's in that mouth. The mouth will actually open. So now what you're doing is you got a horse that's throwing its head. It's not wanting to collect. It's not, you know, it's not comfortable. It's not getting its head down between its knees. It's not rounding. It's fighting you. So what do? You get off, take that cavesson, and you go, I'm going to crank this up. You're not going to open your mouth. Okay, so what we're doing here is, by getting this angle correct and getting rid of some of the pathology, what that allows your horse to do is allows that jaw to slide. How are we doing on time? We're okay? Kind of? Sort of?
Compared to what?
Compared to what? We're 9 o'clock. It's a goal. Yeah, they're guidelines, yeah. Extreme difficult. Okay, so this... we're serving breakfast. Sorry, John. Thank you. Steve. So there's a lot that we talk about here, and you go a long time about this. But ultimately, the take-home message is, this is, you know, from a performance aspect. Canines. Okay, this is the fourth tooth in the arcade. Usually, it's what they call the fighting teeth. No mastication function. Short of chewing on my hand when I stick my hand in the horse's mouth. Short of when you stick the bit in, it hits the tooth first, and those horses jerk their heads up. So we usually smooth these out, get them down below if we can. If we're following the tooth roots, we don't want to open these guys up, but we smooth them out and bring them down. Bringing them all the way down to gum line, bad idea. Find it? Hope. Wolf teeth, highly recommended. Most all trainers are going to have you take these out. There is no reason to send a horse to a trainer without pulling these teeth out first, because they're going to fight. It's the first tooth that the bit's going to hit, and it's not going to be pleasurable. It's a tooth that has no value in the horse, short of, I don't know, me taking out, having me to have an appointment that day. But really, you know, they're the first thing the bit hits. They're a nuisance, and we recommend that you do take them out, and you don't break them off. They're important to not you break them off, because they do become sensitive here. People think, well, geldings have them and stallions have them, but mares don't. Mares have them. That one I took 4 out of was a mare. Same thing with canines. Bit seats, if you don't know what these are, you know, it's very easy to put bit seats in and look like a hero. It's even more to do your bit seats, make your horse balanced, and fix the incisors if you can do that. It's part of rounding. It decreases bit pressure. Occlusion, this is what we're looking for. This is that whole thing about having the fillings, having a cavity, having those fixed, and having those horses, having poor occlusion leads to horses not chewing properly, horses not efficiently chewing their feed. Back before, what we used to think, and one thing I was extremely guilty of was, you round too much. When you've got 100% of tooth, and let's say you got a 2x4, guys, and you got two 2x4s that you're putting together, the more you round, the more you take that tooth and you round them, that means you're taking away from occlusion. You're taking away from how much grinding surface those horses have. So one thing that these guys are wanting you to do is work in 2 planes and 2 planes only. There is no 45 degrees. It is this way and this way. Cheek premolars, we're going to... Percent occlusion is different in every horse. You do not want 100%. If I'm looking at your horse and they're at 100%, you've got an uncomfortable horse. You want these horses to be anywhere between 70 and 90%. And that occlusion has to do with when you slide that jaw side to side, that horse takes a little bit of time before those teeth start to touch, those molars start to touch. What's it supposed to look like start to finish? This was a horse that I've worked on. Got a wedge that I just throw this in so that people kind of understand. This is an older horse. Actually, if you look at this, he's probably about a 20-year-old, 24-year-old horse. Has a wedge. You guys can see that. You can see that this horse is hollowed out here. This horse was not comfortable. He was not eating well. This is what the incisors look like afterwards. If you guys remember what they look like, we had hooks on the side. This is a horse that we could not take the entire wedge out. You see, you still got a little bit of a DGL here. The hooks are gone. This horse can slide its jaw up and down, forward and back. We smoothed this out. We've made this what we call a functional wave. Okay, you're never going to make these whole again. These teeth are expired. They're never coming back. And that just has to do with age. Okay, there's a lot more to cover, but okay. I hope that did it. I can ask questions now, or we can questions. Dentistry. Summer, if you want to come up and give me your computer, please. Or Peggy. Yes. Question. Who's got a question? Yes.
Now that we got all this, we know we need to be doing to these horses' teeth. What's your recommended schedule for different age groups?
Oh, that's a good question. If everybody heard that, it's the question is, how often should horses' teeth be done? Horses' teeth, depending on the age, that's going to be number one. If you've got a young horse that's in training starting at 2.5, some people want them done every 6 to 8 months, depending on how often. You got to think those horses are developing teeth. They're throwing caps. They're developing new hooks every 6 months. So up until about 5 years old. In our mid-range horses, every year, every 14 months, give or take, depending on what you're doing with them. As they get older, you're going to run out of tooth to work with. As we get into our 16, 17, 18-year-old, you're losing teeth. You're losing tooth root. You've got teeth that are starting to expire. You've run out of time to make those horses into straight, normal eating horses. So at that point, now what you're doing is you're going for function. You're making those horses that have waves, you're making them so that they still can get the rostrocaudal movement. You're making them so they can still chew with at least or as many teeth as they possibly can without causing abnormalities. Because as you get older, they do start to move. And that's a whole different realm. We can get into all sorts of stuff. So,
sure.
Yes.
A wild horse, would it get hooks?
It could. If it got hooks that are big enough, they become lion bait because they stop eating. If they start with soft tissue injury, a lot of times what those horses are doing, they're chewing on rocks. They're chewing on minerals. They're chewing on bark. They're chewing on things that are, you know, they've got a way to survive. Otherwise, none of us would have horses. You know, they've made it this far despite the fact that their legs are, you know, a chronic problem and their intestines are a highway to disaster. So how they survive, I don't know. But, you know, that's horses with hooks, and I can show you picture after picture. I could, you know, I worked on 4 horrible hooked horses the other day, and you know, some of those horses eat. The horses will try to find a way to eat. Eventually they get to a point where enough is enough, and because the soft tissue damage is so bad, and now they start with infection. So, and they start with teeth rotting and other problems. So, anything else? Anybody?